Good evening, everyone, and thanks for joining us today. My name is Cristina Gomez. I'm the Client Services Director at Havas Health&You Spain, and I will be the host for today's webinar. During the meeting today, we will see the extract from the report called Patient-Focused Approach in Telemedicine by Telemedi. All the participants will soon receive the full version of the report after registration at business.telemedi.com/webinars. So if you have not registered yet, make sure to do that, not to miss the useful piece full of knowledge and insights. But before we start, let me introduce all our panelists. And let we start with Gabriel. Hello, Gabriel.
Hello, Cristina.
How are you?
Very fine, thank you. Thank you for hosting this event. Really grateful for being here. Well, for all of you, I'm Gabriel Guida. I'm the Medical Network Manager for Telemedi Spain. And well, it's a pleasure to be here.
Thank you, Gabriel. Now, Alfonso.
Hello, good afternoon, everyone. Thanks for having me here today. It's my pleasure being here. I'm Alfonso Formariz. I'm the CEO of Havas Health&You. Havas Health&You is a global communication network within Havas Group, specialized in health and wellness. And we have as our mission to be focused on what we call the human purpose. And I think this is very well linked to the patient-focused approach in telemedicine that we are affording today. So thank you.
And finally, our dear guest, Dr. Avila, please introduce yourself.
Hi, Christina. Thank you for inviting me to this discussion. I'm Javier Avila. I'm a doctor. I am a clinician. I am a GP working in Germany with patients on site, but also online. And I'm also very interested in digital health, and I'm working for a company called Savana that does artificial intelligence in medical research.
Okay, thank you, gentlemen. Now just a few words about Telemedi. Telemedi is the host of this webinar. It's a trusted business partner in advanced digital healthcare solutions since 2014. Telemedi provides business with plug-and-play digital healthcare platform, including various modules and integration capabilities, and thanks to its multicultural expertise and the power of the technology and artificial intelligence, Telemedi solutions are used by an ever-growing number of patients across the world. In fact, the company has recently been recognized in the Deloitte Technology Fast 50 ranking as one of the leading fast-growing technology companies in Central Europe. So, congratulations, Gabriel. But Telemedi's mission is to bring back the most important aspect of digital healthcare, the human factor. And today's online seminar is the company's effort to cover the patient-focused journey once again, drawing on knowledge and experience gained through practice. And speaking about practice, is the perfect moment to introduce the first speaker, Dr. Gabriel Alessandro Guida, who will introduce the report called Patient-Focused Approach in Telemedicine. So, Gabriel, the stage is yours.
Thank you, Cristina. Well, thank you for this opportunity, and I think it's a great chance to talk about what brings us here today, that is this report and this approach that we are proposing in telemedicine. Okay, so Telemedi patient-focused approach aims to bring this new trend of telemedicine focused on and centered on the patient. The main objective is bringing back to the center of all digital health service what's most important in medicine, the patient. I know we are already a bit tired of this subject. Whenever we see that word and we see that sentence, we get a little bit, freaked out, and it's normal. It's only we are still in the middle of it, even if we think it has passed. We are now seeing that it's still here, but it is very important to reference it right now because it's one of the reasons why we are here. If we talk about statistics when talking about COVID-19, we can say that it has affected over 270 million people already, confirmed cases. And we can also say that it has produced over 5 million deaths. But if we talk about people, we can say that it has been even worse because we are seeing economical crisis. We are seeing families getting turned out and suffering due to this catastrophe, this pandemic. Nevertheless, this situation has also fast forwarded some technologies, and more important, it has brought out again the importance of the meaning of being human and caring about each other. We have seen doctors that even if they are burnt out for long hours and working tirelessly, they are still there caring for the patient and trying to give the best of themselves. And these and many other things brings us today to this meeting, where we want to emphasize the importance of having a humane approach in telemedicine and e-health. Something that has been the core value of Telemedi, not right now, but for many years, for all its years of operation, even long before COVID hit and changed our lives. So let's start speaking about digital transformation. Whenever you want to bring these kind of solutions to your company, your hospital, or your private practice, you need to digitalize, you need to change. And there are some things that are really important when you are going through this digital transformation. It's really important to be fast and efficient. And to be fast and efficient in today's world is a really tough challenge, because we need to go and develop technologies, we need to go and develop a solution for the patient, for the hospital, or for the business, that it's really challenging because you need to adapt it to its situation. So when you want to do it in a very good way, you either can spend a lot of money in development, or you can go and partner with someone who has experience. So you can go with a company that has already built this technology, that has already this medical service, and partner with this company to be able to avoid making the mistakes that will affect patients and bring the best service possible. You need to focus on the patient and then focus on the technology. This is really important because the main purpose of telemedicine is to give patients the benefits of telemedicine, which are some of which are the immediate access, the economic access to healthcare, but also the excellent of getting this healthcare solution from excellent healthcare professionals. So this is one of the most important things, because it's really tough to keep the empathy through a channel where we're not used to use in healthcare. It's also important to remember that technology is not mandatory. Healthcare professionals are. We cannot outsource, the technology to perform video consultation or to use a chat to communicate with a patient, but we cannot outsource excellent healthcare professionals. And this is the main subject that we need to address also when digitalizing. Remember, we need to be fast and efficient, we need to focus on the patient, then the technology, and we need to remember that the healthcare professionals are mandatory in a healthcare environment and in a medical service.
But as we said before, we need to personalize, and we need to personalize based on the patient requirements. And in order to do this, we need to focus in 6 aspects that are crucial. We need to go through risk assessment, and the risk assessment that we perform in a patient can be done in different ways. Now we have the technology to go through genetics, artificial intelligence, and other tools that will help us. But even the regular anamnestic approach of a good doctor can do the proper risk assessment. We need to do primary prevention. We need to work on patients even before they are ill or they develop a chronic condition or disease. And in this aspect, also, we have some great new tools, such as wearable devices that can help you track fitness, sleep, and also, heart rate and some healthcare, data. But also, we need to use, all the analogic, let's say, approach that we were already using. We need to focus on giving the patient and some challenges or a path where the patient can do regular exercise, have a great diet, stress management, and mindfulness that has proven to be really good. And with this, we also will develop early detection. That is crucial in medicine, because whenever you develop a disease or a healthcare condition, the sooner is the better, right? So if you have an early detection of disease, you will be able to provide the best medical service. And here again, we can use genetics, we can use wearable devices, and we can use what is most important and known, humane connection and communication. So it is really important to establish a really good patient-doctor relationship. After we have detected something, we need to do an accurate diagnosis. And here is also where the company and the doctor need to focus on the patient and then on the technology, and we have to put the patient in the center of this approach. Because once this condition is or disease is detected, we must use all resources we have to get into an accurate diagnosis. We all know, well, we all doctors know that a wrong diagnosis, it's really harmful for the patient. So this is a very important thing. And it's also important to emphasize that the responsibility of the outcome of the diagnosis and the outcome of the consultation relies on the doctor. So this is a very important aspect that we need to emphasize. And it's also important to give early treatment for the patient, and the best availables are those that can be targeted. Again, we have some new technologies, and we can use artificial intelligence to help us with accurate diagnosis and early treatment, but it's not the only way we can do it. So we can use telemedicine, the way of communication through telemedicine, to give the patient this early treatment, having a very fast and efficient communication between the doctor and the patient. And then there is the chronic management and secondary prevention. Once we reach this level that we know that this condition will go on, it's important that we use the proper tools that we have to bring the best solution for the patient. So here we have wearable technology that is already being used, and we think of wearable technology as something really, really new, but we have been using this in medicine for a long time already, because, for example, pacemakers, they can track, how the heart rhythm is the heart rhythm behavior of the patient, and this can also be useful when they go to the cardiologic consultation. So telemedicine has no age. We can start as soon as we are children, even before. We can start using telemedicine even before we are born, because when we are in our mother's womb, our mother can consult through telemedicine. And we can use it even if we are 98 years old, because we can use it to control our chronic conditions or disease. And it's really a very suitable technology for the elderly, even if we think that is not the right approach. We've seen sadly, with the COVID pandemic, how it can help with the older patients. So in telemedicine, some of the biggest challenges come to the human factors, come to how we communicate and how we express ourselves, and how do we enhance the digital experience of the patient. It's important that the doctors practice active listening. Doctors must be giving their best to show that they are listening to the patient, regardless of the channel we are using. It's hard when we are talking through chat. A little word can, change the outcome or the perception of the patient, but it's also hard when we are listening to the patient through the phone, because we cannot see their facial expression. But even if we have video consultation, it can be hard because we are not seeing if the patient is standing, sitting, relaxed, anxious. It's really hard to use this. So active listening is a really important tool and a really important factor determining the outcome of telemedicine. The process of the consultation needs to be done through concerted decision making. And this is something that is really important, and some really good studies have proven that the medical therapy is not the only treatment the doctor is given. Therefore, the decision that the patient is taken has to be agreed upon with the doctor. This will also enhance the doctor-patient relationship, creating an environment in which the patient can feel free to express their concerns, but also creating a relationship that will be long-lasting and will enhance the outcome of the treatment. This topic, the doctor-patient relationship, I know it can be a topic by itself. We could have just a webinar just for this, but really, I think it's really important to emphasize the importance of this when we are talking about patient-focused, patient-centric approach. And this is a factor or a new concept that we are bringing here, that we are listening now in the medical environment, that it's called digital empathy. We all know that as doctors, we must have empathy, but how to express and how to use our empathy through a digital channel. So it's one of the most novel and challenging concepts. It's just reaching out to the patient feelings, even if we are doing it through a digital channel. And this is really important when we are trying to give this added value to the patient and trying to find the best medical solution for the patient. Through it, we will create engagement, and engagement is not an outcome that we will search throughout the consultation, but it's what we will get as a reward from the patient when we see that we've done our job properly. So patients' needs. We have to help the patient create their own journey. And how are we going to do this? Well, we need to go to the patient health conditions and disease, because the patient will always have a reason for the consultations. And this reason might not be obvious at the beginning. It's even harder to find this reason through telemedicine. We might even have, some artificial intelligence triage symptom or symptom checker that will help us, and maybe we'll get some information. But in the end, when we are talking with the patient, we'll see that the system was biased because maybe the patient didn't know how to express himself or herself with the system. So this is something really important. So we need to really focus and find this health condition or this motive of the consultation. We need to use doctors' guidance and coaching, because it's an environment through telemedicine that we can use. And with this approach, we'll be able to use properly this channel to create a long-lasting relationship. As we said, the concerted decision making and the final recommendations of the consultation that will help the patient go back to it whenever they need it. So the telemedicine and e-health solutions, there are a different wide spectrum of products and services that we can provide. But let's start with the complete consultation, that regardless the consultation channel, chat, video, phone, or any other, the patients should feel that their needs are fulfilled. So one doctor for many chats and one video or many videos might not be the right solution depending on the context of the patient. Wearable technology, as we said, is not the new solution. It's part of the solution. It's part of the tools we've got. And this is something that can allow us to receive also information and create some kind of indirect communication between doctor and patient. So it's really good service that we can use. Blended or hybrid method, where we use digital and regular medical approach. This is shown to be one of the best solutions available right now to get the best of both worlds, as we say. Artificial intelligence that will help us complement, but not substitute, the medical consultation. And finally, ad hoc solutions in e-health. So a company needs to adapt to its client and to its patient, and we as doctors must do the same. Thank you very much for this time, and now let's get back to.
Thank you very much, Gabriel. I think it has been a refreshing piece of knowledge for all of us. I do have a feeling that the patient experience is essential. Although many solutions today seem to skip or marginalize it, the technology is often seen as deshumanize it. But I want to know, what are the key benefits of focusing on the patient? Please, Gabriel, tell me, what are the main benefits?
So the main benefits, and I think we can all agree, is that the patient will feel like they're being listened. We will give the best medical solution for the patient, and we'll be able to attend really their needs. In the end, what we are looking to do through telemedicine is not different of what we are already doing in regular medical approach, that it's giving a patient the solution they need. So when we're focusing about technology, sometimes that I've seen, sadly, throughout this telemedicine and e-health environments, that they are some companies and some doctors even are focusing more on the technology than in the solution and in the patient. We get that sometimes we want to apply things that don't really are applicable in this case, and we're giving the patient the wrong solution and not taking advantage of the whole situation. I don't know if you agree, maybe.
I think this is an interesting insight, and I want to know the opinion from the other doctor in the room, Dr. Javier Avila, because he's a well-experienced doctor who treated thousands of patients in Germany for the last couple of years using telemedicine. So, which difference do you find between the traditional and the e-health system?
Yeah, I agree with Gabriel that telemedicine allows for a much more patient-focused healthcare because instead of the patient having to come to the doctor or to the health center, with telemedicine, the doctor comes to the patient and is much more available than it was before. And not just any doctor, maybe the good doctor, because maybe the good doctor, the specialist, doesn't live in the same city or is not providing care in the same city or even in the same country, theoretically. It could be the case too. And with telemedicine, you have access to that kind of doctor, and the follow-up of cases is much easier. I believe that in the next years we'll have a revolution also in what you were saying before, Gabriel, in the measurement of vitals and variables at home too. So maybe some of the limitations that telemedicine has nowadays will be in the next year will be overcome also with new technology that will allow us through wearables or through other devices to give more information to the doctor about the clinical course of the patient. So I think telemedicine is a great complement of traditional healthcare, and it can allow. It much more allows for the doctor to have the patient much more in. To be more focused on the patient's needs that weren't covered maybe before as well by the traditional medicine.
I think also, and sorry that I jump in, it's
Don't
just
worry.
since we are here and talking, I think it feels natural, just
Yeah.
to sometimes jump in with this, and I think that we don't realize the time the patient loses when they need to go to the doctor and the effort they make to come to us. So what you say, Javier, that we are coming to the patient, as as medicine used to be in the early stages, that doctors would come to the home of the patient. Now, due to this industrialized world and due to the needs and the quantity of doctors versus the quantity of patients, as you said, sometimes you don't have the specialist in that town. So if a patient needs to go to a specialist, a cardiologist, let's say, needs to travel to another city, so that requires, someone who takes them there, or even themselves to drive there, or to get public transportation. And if you get a patient that is in, delicate conditions, such as elder patients, for example, that they are pluripathologic patients that have different kind of healthcare conditions. Sometimes they have problems walking, and that thing right there is where we are going back to basics. We are going back to the place we started and giving this approach, giving this focus back to what's important. That's patient, the patient and the patient needs. So I think it's really interesting when you brought it up. As my eyes were widened because it's what I love about telemedicine, that we can be able to provide the healthcare, but not making it difficult for the patient.
Yeah, there are lots of factors that could make it difficult for the patient to go to the doctor. Just yesterday, I had a case of a patient that was living in a small town in Germany and was ashamed of going to the local doctor, because he had something related with sexual transmitted disease, and he didn't want to go to the local doctor for that reason. And Well, there you have an example of a reason that may be not common, but it's a reason for, so the patient had a much better access to a doctor through telemedicine than going to his local doctor. And he was able to ask the question that he wanted to ask and get the treatment too.
And what about the advantages for doctors?
Well, for me, I have to say that I've been working in telemedicine maybe for 1.5 years now. In Germany, you have to think that it was forbidden 3 years ago. It was forbidden. Other countries started earlier, but in Germany, we started 3 years ago. And I have to say that I'm so surprised how well does it work. I've always worked with patients on site. I mean, since I started being a doctor, and only in the last 1.5 years I started doing telemedicine, and it's incredible how good it works and how good is it for me, because it allows me to see patients in a very flexible manner. Like I said in the introduction, I do lots of things, not just clinical work, and to be able to coordinate everything's much easier with the help of telemedicine. I see patients in the morning, patients at night. I don't have to see them all in one block, and I can do research in between patients. I can choose when I want to see the patients also. So for me, it's incredibly, has a lot of advantages for me as a doctor. I also like to see patients on face-to-face, but like we said before, you can combine both pretty well. And I like to follow up patients too, because sometimes patients come to the office, you see them once because but as we said before, it's not, for some patients it's not easy to come, they don't have so much time. And maybe they come once and you give them a treatment and you never know how that treatment worked because they never come back. With telemedicine, you make it much easier for the patient to be able to report what happened. So for me, it has a lot of advantages. We can maybe talk more about them later.
It's very interesting for us, know your experience.
Yeah, absolutely. I think, we talk especially about technology. Technology couldn't be a barrier, but could be, a solution, definitely, right? The best technology is the technology that you can see, right? So it's just, embedded in your daily life, like a normal one. So facilitating the connection between people, right? So and I think that is the key thing.
And we're using it every day. So for me, it's amazing how some countries forbid telemedicine, or used to have this kind of legislation, but then, social networks, social media is everywhere, and it's free, and it's the access. It's not even regulated in some cases that it should be. So legislation in telemedicine sometimes is arriving even. Well, we've seen with COVID, it's so late that we had a pandemic and we weren't prepared, having already technology there to use it. So I think it's really important to talk about this and to, emphasize the benefits of it, as you were saying, Javier, because it's really, from my perspective, I see more benefits than problems. And I think that if we focus on what's important, it's the patient, we'll always get a good advantage of it.
Thank you, Gabriel. Now I want to know the opinion from Alfonso Formariz, the CEO of Havas Health&You in Spain, because I think that he has an holistic view on all the major trends in the healthcare these days. Alfonso, do you agree that the patient focus is continuously a priority, or it is often secondary? What do you think?
So if I can, see especially our clients, maybe it's the pharmaceutical companies, and especially the innovators. So definitely I think there is no better priority right now than patient-centric approach. Definitely this is embedded in all the strategic decisions of the companies, from the research and development to the market access, to the promotion, to the commercialization. Everything is about the patient journey right now. So, and it is very important to understand your patient from the condition standpoint, but also from a daily living standpoint, and how they use the technology, how they are prepared also to use the technology to take the right decisions in developing whatever is your product or your service in the right way. So for me, it is clear that patient-centric is definitely the right approach, and it is at the center of everything, right? So probably in the other side, when we talk about when you develop your service or your product, if you are very good oriented into the user experience, right, on the customer experience in the end. So you can have your vision, and your vision could be that one, but then when you go through the reality and you develop, you need to apply the elements of the customer experience very well. Otherwise, the experience of the patient or the healthcare professional couldn't be what you expect to do or expect to be, right? So, but definitely this is for me clear that it is absolutely a must, and we realize this in our connections with our clients every time.
Many of the patients that I have every day, they're first users, because like I said before, in Germany, we don't have that. I mean, many people are starting to discover, many patients are starting to use telemedicine right now, and they're surprised. They say to me, wow, what a great service this is. I mean, they're very satisfied. I get a lot of good feedback directly on camera, but also afterwards they write something. Yeah, so
that's one of the questions that I had prepared for you, because I wanted to go in deep to the experience in your daily routine with the patients and know how is the global picture of the treatment that you follow with the patients through the telemedicine.
So as my daily, well, like I said before, I have my computer on all the time, and then I get cases when I have time to see patients. When I'm not in the office seeing patients on site, or I'm doing other kind of work, I take cases, and then when I take them, normally video, it's a video consultation, and then at a certain time we connect, the patient connects, signs in the platform, on the platform, and me too, and then we see each other. And to be honest, I mean, like, to see each other on camera, I think it's really important that it's video consultation. I think that makes a difference too. It's better than phone only. And to be honest, I mean, of course, face-to-face is great too, but it's not always better than the camera, because the camera is very, if somebody's listening to you, like really listening to you, like you were saying before, Gabriel, and they're on camera, it can become very personal, very, very close communication. Maybe even better than many consultations on site, where the doctor's not listening to you, has something special, like the video consultation. And the patient is at home, you're at home alone too, so there's a lot of, maybe sometimes in the office you're distracted by the routine of the office. I don't know, somebody knocking on the door, or the phone ringing or something. So that's my, I mean, I see the patient, we talk, they tell me the problem they have, and I sometimes, most of the times I have to say, I can solve the case online. Sometimes we need tests and we need a physical exam, and in that case, what I do is I refer them to my office, and if they don't live in Berlin, where I am, I refer them to a different doctor. But that's not most of the cases. I mean, many cases can be solved online, because I can also order tests that maybe are done at a local doctor, and they upload the results online too. So that's how you work. I manage patients online in my daily routine.
And Gabriel, what's your point? Because you received the feedback from many doctors.
Yeah, you know what he said about the video being magical and being able to connect with the patient in a different level that sometimes you cannot reach through a normal consultation seems odd or strange, and sometimes we don't understand this until we do it. And Javier, you're not the first doctor who says something like this to me, because we've faced some resistance, from doctors that sometimes when they haven't used telemedicine before, they don't think of it as we're talking right now, And when you use it and then you go back, and when I receive this feedback and they tell me, the patient opened themselves in a different way that they don't usually do in normal consultation. Or like you said, I was there alone in a quiet room, no one knocked at the door, there was no noise, no sound whatsoever. It's different, it's better, for some types of consultations, of course, because as you said, sometimes we need other things and we need to use it, and that's where the beauty of a hybrid model where you can tell the patient, we'll go to your home or go to this office, this hospital or this lab and get these tests. It's that's the beauty of it. So I think it's really amazing, and I like I said, I get this feedback from other doctors as well, but as Javier said it right now, it was really beautiful because you used the perfect words for it. So thank you, man.
Especially with the masks that you have to use in the office nowadays. I mean, it's great to see the patient's face and they see yours, which is not possible in the office. So that makes the communication a lot better too.
Yeah.
Thank you. And Alfonso, talking about experiences, have you had any own experience with telemedicine? Have you proved it?
Yeah, I think that potentially, most of the people right now in the last 2 years for sure have some kind of experience. I have two different kind of experience. I was living in the US for the last 2 years, so where telemedicine is quite developed, and I use telemedicine services. Also, I have 3 kids, so it was very, very convenient at that time. So, and also when I came back to Spain as well, so I'm using, some services of telemedicine. What I find commonly in using telemedicine is the need of flexibility. Because when we talk about focusing on patient, even the same patient is not always, requires the same things when they have a consultation, right? So it's not the same thing when I using telemedicine for my kids. The expectations, the time, the results, what I have in this consultation is different when I'm talking about, managing some chronic disease condition, right? So when you require certain kind of things, more, seeing the same doctor every time, discussing with the same person because they know you, he or she knows you, and have a better conversation about that, knows who you are, what's the evolution of your condition, and you can establish a better communication and better connection. So different kind, but for me, flexibility, adaptation to the patient's needs, it's definitely crucial. And to your point, Javier, I can agree more, right? So it's like a paradigm, right? It's like how telemedicine is better to focus in one task. Avoid multitasking is something that avoid just to focus in what really matters, with this conversation with your patient. And I think what the patients, requires the most, right? Treat me as a person, understand me, hear me, look at me. So I think that is definitely one of the, let's say, the magic of telemedicine today, and yeah, definitely this is a good thing.
And when you work in a telemedicine company and when you work in different and you know different approaches and ways of practicing telemedicine or softwares to develop yourself as a doctor through telemedicine, that it's my case, you can really value when a company is focusing on the patient. Because the multitasking that we see sometimes in face-to-face consultations can happen in telemedicine if the healthcare provider doesn't focus on the patient, because then you will have several tabs to do several different things, or maybe you need to open one program for video, another for chat, and stuff that doesn't allow you to focus on what's really important, the patient. So I really value this of what Telemedi is doing in this patient-focused approach, because I think it's bringing what is most important in medicine.
I would like to come back to Alfonso, because I will come back to the holistic view on the healthcare industry that you have, and we want to hear what are the major trends these days globally.
All right, so I think probably we will need another webinar to talk about major trends, right? So I tried to summarize, a few of insights that we received from our collaboration with our clients that used to be, apart from pharmaceutical companies, also insurance companies, hospitals, and of course patient associations or medical scientific societies as well, no, with regard with the trends. So I think the first one, I think you mentioned before, Gabriel, is the impact of COVID in healthcare, right? We used to talk about this topic, but for me, when we talk about the impact of really COVID in healthcare, it's more to talk about how COVID has accelerated some of the specific technologies that have been developed previously for other industries, right? The acceleration has been stunning, definitely. And we start using this technology in the healthcare industry more often and more commonly, right? So this is, for me, this acceleration of this existing technology is clearly so. Well, when we talk about voice recognition or face recognition, which are technologies that already exist, how to apply this into telemedicine, it's amazing, right? Because you can identify during consultation how is through the voice of your patient, what is the mood of your patient, and then you can react, really on real time, to drive the conversation in a different way because you know the mood of your patient, right? So things like that has an impact into the healthcare, and COVID has accelerated. It's not more of creating new technologies or new products, is to use existing ones, reimagining, re-energizing them in a different way, to focusing again in what matters, which is the patient, and to solve the patient problem. That's probably one of the things, right? The other one is, you talk about that, Javier, and I love it, definitely. Mm-hmm. It is what I call, the effect of guest versus host, and this is changing everything, right? In traditional medicine, exactly, the patient is the guest, right? You go to your doctor's office, you go there, so the conversation, even the position between the two people is a bit different, right? Yeah. I'm going to your house, so is different. And right now in telemedicine, the doctor is the guest. Mm-hmm. You go into the patient's house, into your life. So preparation for having this kind of conversation is a little bit different in both sides, in the patient side and in the doctor side. So this is a real paradigm that I think it's very interesting, and also you find that when you are inviting doctors to your home, guest versus host, I think that's a good thing. Another one would be the patient journey. I talked about this before. So, but understanding the patient journey is critical to develop the service. And when we talk about patient journey, it's not only the patient journey from the perspective of the condition. So I used to work for pharmaceutical companies in oncology or in these kind of conditions where the stages of the condition are very crucial for taking the right decision on the treatment stage, what is the right treatment. It depends on what is the patient journey in that case. So knowing this is very important, but this is part of the healthcare professional task. Yeah. But in the other side is the patient journey from the perspective of understanding their daily life and understanding how they interact with the technology, or even which kind of technology they used to use, right? Because as we said, technology couldn't be a barrier, and definitely, the patient journey has to inform us as much as their condition, as well as the satisfaction with the service. Another one is about customer experience, which is directly linked to that. Customer experience in the and user experience principles of design when we develop different services is absolutely crucial. For that, we need to understand the telemedicine process from the beginning, prior to the telemedicine visit. What could be the pain points there, right? So we talk about that. This is pre-forms that the patient has to fulfill prior to the visit. Couldn't be so convenient, or not based on the user experience, not taking in consideration diversity of the patients in many ways. So it could be one thing. During visit, telemedicine visit, of course, I think one of the bigger challenges is physical exams or report, symptoms from the patient, right? Something which is very, very difficult, even, in life visits, which is
normal
talking about pain.
Yeah.
What's your pain? Where is the pain? How it is? Things like that. Even during the visit consulting are definitely could be potential pain points, and we can use different elements of technology to solve that. Or post-consultation. I think this is another one key point for me on the overall experience of telemedicine is post-consultation, because it's the right moment for the doctor to keep informing the patient on the follow-up, on the next steps, on the remembering things after what happened during the call. And in the patient side is the opportunity for the patient to make questions, to reassuring what I have to do or not, because especially when we talk about elderly patients, this is something which is crucial, right?
Yes.
It is to take my medication, how,
Did I took it or not?
I have to take it or not, what they said, have to change or not, things like that. I think there is an opportunity there on the customer experience. For sure, from the patient standpoint, I think the key measure of success is satisfaction. So definitely, and satisfaction has to be the objective when we build our service, right? Satisfaction of the patient in telemedicine, right? So many patients report, and we talk about that I want the doctor paying more attention to me as a person than effectively, fulfilling forms in the screen or avoiding this multitasking that we already discussed, right? So there is a lot of things, to help him listen better to that. And finally, I will mention, because we used to talk about the patient, and that is very important for sure, but also the physician. And we cannot forget that in the new telemedicine world, everything that the physician has to do usually, or has to be convinced about, his or her career, very well trained in what they know to do, couldn't work in the virtual space. So building a good telemedicine curriculum for doctors and healthcare professionals is crucial to help them in facilitating the conversation with the patient. So I think that making efforts in training the healthcare professional and helping them in develop their skills in telemedicine has to be in parallel with the development of the services and technology, definitely.
Yes.
And finally, probably just to say that this is the beginning, it's not the end, of the journey. So that is exactly, as you said, a lot of things to do and to manage, but definitely it's some of the insights that I hear from my experience in the business.
Thank you, Alfonso. I think we have covered all the main topics for today's webinar, but I have a final question. I don't know if you have the answer, but I would like to talk about what's next in telemedicine. What's the future? How can you do it to be more closer to the patient?
It's a good question,
Even more?
It's a good question. I think the beauty of that question is that each one of us might give a different answer, There is a lot of technology coming, very exciting time to be a doctor, I guess, because there is many things happening at the same time, and we're finally, I feel like medicine is connecting with other technologies that we're developing, aside. So it's really exciting, and we will have a lot of things coming now, but we can say that the wearable technologies that we are facing right now, it's a reality that now we see every time more patients use it, right? So I think wearable technology is something that it's going to help a lot in telemedicine and in this patient-focused approach, and we need to use it right. We need to use this as a tool. We don't need to get obsessed with this and maybe ask the patient to get things that they don't need, but to use it properly and to use the information we are getting to provide the patient the best service. So maybe if we are only getting the steps the patient is making, because the patient has these watches that just measure steps, and it's an elder patient, this can help give us a lot of information of how we are going to improve the patient's health. So I think what it's, from my perspective, coming to telemedicine is that we are going to start applying every day more technology in the right way. It's not the technology that will come, it's that when we are going into this process of focusing on the patient, we will use the technology, as Alfonso was saying, in the right way. We are going to be more creative, and we are going to provide a better service for the patient. And it's only the beginning, that you say.
Would you like to add something?
Yeah, I also think it's just the beginning. I mean, the technology is going to improve the communication. I mean, like for a good consultation, the internet speed is essential. I mean, you have to have a good video signal and sound, and sometimes maybe in rural places, you know, some places in Germany or maybe here in Spain, the internet is not good enough, and when that improves, that's going to make telemedicine accessible to anyone. But also in the near future, I think the measurement of all kinds of things at home or maybe in special centers to be measured and then transmitted to the doctor. So it's not just going to be conversation with the patient, but also measurement and physical exam. And maybe in a little bit farther future, virtual reality. So I think this is just the beginning. Like Gabriel was saying, we're at the infancy of telemedicine, in my opinion. And patients are already very satisfied with that. So I think in the future, maybe just, like I said before, like 90% of the consultations might be resolved online. With that, you can save a lot of resources, time of doctors, time of personnel at the office that can be dedicated to cases that really need it, that really need to be face-to-face and be examined on site. So it's going to be a better use of the resources in general.
Alfonso?
Yeah, just to conclude in that side, I think that what technology allows us is to collect an incredible, like never before amount of data. So how we interpret data and use this data with the aim to create good experiences for patients and physicians throughout telemedicine will be crucial for me. So focus on data and focusing on the right technology, I think that definitely will be the good thing here.
And to finalize, just give me one headline, like a tweet, with your main message to summarize your opinion from today's webinar.
Okay, I will be last this time because I'm always, jumping in.
You need time to prepare.
Yeah, I need time to prepare my answer. So I think let's start with Javier this time.
What do you mean about telemedicine? Like a sentence?
The main message that you want to give to the audience from today's webinar.
Okay. I didn't think of it, but maybe, I mean, the main message that I would give, because I was skeptical like 2 years ago, I have to be honest. I mean, like as a doctor, I was skeptical that telemedicine would be something that would be very useful. I mean, I thought, okay, maybe it's not bad, but I didn't think it was as great as it is. So maybe the main message would be try it. I mean, like try this technology, try with a good doctor to be online talking about your problem instead of spending 2 hours of going to the doctor's office in 5-10 minutes. Talk about your problem with your doctor online and tell me what you think.
I would say the critical success measure of telemedicine is patient satisfaction. So building everything from that. This is the patient-focused approach that we are discussing today, and I think this is the right thing to do, definitely for the patient and for the healthcare professional.
Well, as you said, it was like a tweet, right? So I will try to keep it short. So I would say, like, focus on the patient, keep the patient on the center of your practice, and then focus on the technology. I would just leave that, and that's it. That's what I would say. That's my message. Let's focus on the patient.
And my message of try it is not just for patients, but it's also for doctors.
Yeah.
Because I think if you're a good doctor out there, I mean, you can you can share your skills with a lot. You can become much more accessible thanks to telemedicine, instead of just having a couple of lucky patients that live in the same city like you live, but to make it available to other doctors, to other patients in the rest of the country, or maybe in other countries too.
That's right.
Yeah.
Perfect. Thank you, gentlemen, for this wonderful evening. We are finalizing the event today. I just want to remember that it is important to make sure to register at business.com, telemedi.com/webinars to receive the full report about the patient-focused approach in telemedicine. So thank you very much, everyone, for joining us.